Hello, and welcome back to the Self-Paced Independent Facilitator and Self-Determination Training. As a reminder, the Independent Facilitator and Self-Determination is a six-part training, as you can see on your slide. And today we will be covering Part 4, Knowledge and Skills. At the end of Part 4, there will be an activity which you will need to complete to move on to Part 5, and so on until you finish all six parts of the Independent Facilitator training. Instructions for the activity will be provided at the appropriate time during the training, and you will have access to this PowerPoint slideshow and any accompanying resources for each part. In today's module, Part 4, Basic Skills and Knowledge, we will cover what you need to know about laws and resources, as well as what skills and knowledge you should possess as an independent facilitator. I haven't joined you yet, but my name is Scarlett Von Thenen from the Orange County Regional Office of the State Council on Developmental Disabilities, and I will be helping you along this module to prepare you to be an effective independent facilitator. This slide shows some of the disability history timeline and how far we've come. We gain an understanding of the history of disability and how that history affects people's lives today. Some of the legislation we will highlight have been monumental achievements in the disability rights movement, and really the reason why we are all here today listening to this webinar. The Lanterman Developmental Disability Services Act of 1969, for example, is a California law that established the rights of people with intellectual and developmental disabilities to receive services and supports that will allow them to live a more productive and independent life in the community. The Lanterman Act establishes the regional center system that must provide these services and supports that allow a person with a developmental disability to integrate into the mainstream life of the community. As you guessed, your ability to be an independent facilitator in the self-determination program is due to the families in the early 1960s that fiercely advocated for the state to change and improve services and systems for persons with developmental disabilities. These parents and their fierce advocacy ultimately led to Frank D. Lanterman authoring this landmark legislation. So what's the takeaway here? As an independent facilitator, you will have the power to change attitudes, systems, and improve the lives of persons with developmental disabilities. You have the power to empower your clients and others to dream and think big, think beyond and outside the box, and dare to help your client make their own path. You can be the trendsetters as some of the first independent facilitators in this program. People's advocacy changes and creates laws. As an independent facilitator, you will want to familiarize yourself with the primary agency serving persons with developmental disabilities. These agencies are the Regional Center System, CalOptima, Orange County's Managed Medi-Cal Plan, In-Home Supportive Services, IHSS, and Social Security Administration's disability benefits, such as Supplemental Security Income, SSI, and Title II benefits, such as Childhood Disability Benefits and Social Security Disability Insurance, SSDI. As you likely know, the Regional Center of Orange County is a nonprofit organization contracted by the state to coordinate lifelong services and supports for individuals with developmental disabilities and their families. The Regional Center is the first stop for those seeking to obtain local services and supports. CalOptima provides health care coverage for Orange County residents who are eligible for full-scope Medi-Cal. In-Home Supportive Services, IHSS, is a state program administered by each county that helps pay for personal care and domestic services so that a person with a disability can remain safely in their own home. To be eligible, you must be over 65 years of age, blind, or have a disability. Children with disabilities are also potentially eligible for IHSS through the Regional Center's institutional deeming process, which disregards parental income in order to make a minor child eligible for Medi-Cal benefits. IHSS is considered an alternative to out-of-home care, such as nursing homes or board and care facilities. Social Security Administration offers cash assistance to people with disabilities who qualify under either the Supplemental Security Income, SSI, or Title II benefits. Each benefit has its own different eligibility criteria, so it's beneficial for independent facilitators to go to the SSA website at www.ssa.gov to understand what to expect from Social Security during the disability process. In addition to the primary agencies on the last slide, there are also a plethora of additional supporting agencies that serve children and adults with developmental disabilities. There are so many supporting agencies that they would not all fit on this slide, so we tried to capture the essence of the agencies out there serving the community. These supporting agencies include various community-based organizations that include nonprofits that provide supplementary services and support, such as recreational support, therapeutic support, social skills training, parent support, etc. There are also county and local government programs serving persons with disabilities, such as HUD for subsidized housing. Another entity would be California Children's Services, commonly referred to as CCS. This is a state program administered by the counties that provides diagnostic and treatment services, medical case management, and physical and occupational therapy services to children under the age of 21 with a CCS eligible medical condition, such as cystic fibrosis, hemophilia, cerebral palsy, etc. There are additional agencies, such as the Department of Rehabilitation, that provides vocational rehabilitation services, employment services for working age persons with disabilities. Another resource is the Orange County Transportation Authority, OCTA. They provide a means of transportation for many persons with disabilities who do not drive or opt to use public transit to get to and from places. And the Orange County Mental Health Behavioral Health Services Department is a county agency providing treatment, intervention, prevention, navigation, and support to those with behavioral health needs. Additional supporting agencies include the various advocacy organizations that are established to help parents and persons with disabilities alike navigate these various systems. Disability Rights California is a nonprofit agency that's the largest disability rights group in the nation. Federal law established DRC to protect and advocate for the rights of people with disabilities. TASC specializes in special education support for people with disabilities from birth to age 26 and their families. Their role is to provide support and educate parents about special education systems and processes so that parents can be a more effective participant in their child's education. And us, the State Council on Developmental Disabilities. We were established by state and federal law as an independent state agency to ensure that people with developmental disabilities and their families receive the services and supports they need. People with disabilities know best what supports and services they need to live independently and to actively participate in their community. Through advocacy, capacity building, and systemic change, we work to achieve a person and family-based system of individualized services, supports, and other assistance. We would be remiss to not address the school districts as a primary agency serving students with disabilities during their formative years. School districts provide special education and related services at no cost to students with unique needs from ages 3 to 22. As an independent facilitator, there are key terms you want to familiarize yourself with. These are generic services. IHSS, the school districts, CCS are also samples of generic services. Regional centers are the payer of last resort. Regional center funds shall not be used to supplant the budget of any agency that has a legal responsibility to serve all members of the public and is receiving public funds for providing those services. The easiest example of this is for an adult who needs health insurance. Medi-Cal would be the generic resource. For a child who has orthopedic needs and requires durable medical equipment, California Children's Services, CCS, would be the generic resource. Whether in the traditional model or in self-determination, families and persons with developmental disabilities need to first try to access the necessary service from the generic resource. But as mentioned earlier in an earlier module, you don't want to use your individual budget and self-determination to pay for services that you can get for free from another agency. Utilizing generic services first means that your self-determination dollars will stretch further. If, however, the generic service denies your request, then you may go back to the regional center with a denial letter and present your request again. At such point that you exhaust the other public service agencies, you should represent your needs, requests, and denial letters to the regional center for their funding and address it as an unmet need in your self-determination budget. Another term in the disability world is called circle of support. This is just a fancy way of saying your friends, family, and your community, and those around you that can improve the quality of life for the person with the disability. Everyone needs a friend, a community, and someone they trust. Finding these people will enrich the life of any person at no cost. As an independent facilitator, you will also want to familiarize yourself with the various laws such as the Health Insurance Portability and Accountability Act, HIPAA, the Americans with Disabilities Act, and open meeting laws such as Bagley-Keene and the Brown Act. Disability Rights California published a fantastic publication entitled Rights Under the Lanterman Act, commonly referred to as the RULA. It is a comprehensive, easy-to-read publication that explains a person's rights under the Lanterman Act. It explains regional center services and how to get those services, as well as the process for handling disagreements. This and the next two slides are a direct cut and paste from this publication that lists some of the services and supports that the regional centers provide. As an independent facilitator that may be assisting your client or even a parent assisting your child, this list is non-comprehensive, but it helps you identify services that can be obtained from the regional center. It may also give you ideas to look for that may help round support or provide a more holistic approach. To ensure accessibility for all users, I'm going to read through the services and supports on this slide and the next two. Adaptive equipment services, advocacy, advocacy assistance or facilitation, assessment, assistance in finding, modifying, and maintaining a home, behavior modification, camping, child care, community integration services, community residential placement, community support facilitation, counseling for the consumer, counseling for the consumer's family, daily living skills training, daycare, development and provision of a 24-hour emergency response system, development of unpaid natural supports, diagnosis, diapers, domiciliary care, education, emergency and crisis intervention, emergency housing, emergency relief for personal care attendants, evaluation, facilitated circles of support, facilitation, including outreach and education, facilitation with a facilitator of the consumer's choosing, financial assistance, follow-along services, foster family placement, habilitation, home location assistance, homemaker services, identification of circles of support, infant stimulation programs, information and referral services, mental health services, occupational therapy, paid neighbors, paid roommates, parent training, peer advocates, personal care or assistance, physical therapy, protection of civil, service, and legal rights, protective services, provision of circles of support, recreation, recruiting, hiring, and training personal care attendants, respite, respite for personal care attendants, self-advocacy training, sexuality training, sheltered employment, short-term out-of-home care, social services, social skills training, socio-legal services, special living arrangements, specialized dental care, specialized medical care, speech therapy, support services for consumers in homes they own or lease, supported employment, supported living arrangements, technical assistance, training, transportation services, travel training, treatment, vouchered services, services and supports that are necessary for families to maintain their children with developmental disabilities at home when living at home is in the best interest of the child, services and supports needed to maintain the strength of the family unit where one or both parents is an individual with a developmental disability, and other service and support options which would result in greater self-sufficiency for the consumer and cost effectiveness to the state. This brings us to what is systems navigation. An independent facilitator needs to understand and do systems navigation. There are many organizations that help individuals with intellectual and developmental disabilities throughout their lifetime. However, many self-advocates and families become overwhelmed when trying to navigate the complex constellation of organizations, agencies, and services that can provide assistance. Unfortunately, all too often, parents and persons with disabilities get a list of agencies without clear explanations of what they are, how to access their services, and helpful strategies for getting the most of these supports. Likewise, educators and other disability professionals are unaware of these resources or uncertain about how to best connect the person and their family to the formal and informal supports in the community. This is your role as an independent facilitator. You are charged with helping your client connect to resources, services, and people that can help them accomplish their dreams and goals. We have shared this slide during a professional development training and to parent mentors at various community-based organizations. While we would never expect an independent facilitator to do these things, it's worth mentioning, as these are the most frequent frustrations shared by persons with disabilities and their parents. First, do not send the parent or the self-advocate on a wild goose chase. You, as the independent facilitator, should find the most viable resources and after vetting them, share them with your client. Do not give your client, the person with a disability, a list of 15 different places to call, not knowing if any of them can really help. This is sending them down a frustrating path that frankly they probably don't have time for and makes someone feel defeated in the end. This should go without saying, but if you promise to call back on a certain day or a certain time, do as you say and call or email the person back. Similarly, don't promise something and then don't deliver. And don't promise that a program will provide totally successful results. People respond differently to different programs, therapies, and approaches. So just because it worked for some does not mean that it will work for all. And also don't be unrealistic with outcomes and again promise something that you just can't deliver. Oftentimes it takes a community. So let's use the community to get the best outcomes we can for those you serve. Here are some systems navigation strategies that may help you as an independent facilitator. Keep your records. Record keeping is crucial in the intellectual and developmental disability service delivery system. Help parents compile their child's medical, educational, or other records in a way that allows them to have what they need when they do reach out to agencies for assistance. Use the internet. One can find almost everything on the internet. Being mindful of the source, the internet can help parents and providers find answers to common questions. Just be sure to fact check. Connect with parent mentors. Help the parent connect with other similarly situated parents for resources, guidance, and support. This is a great starting point in systems navigation so that parents or persons with disabilities are connected with someone who has been there and have the advantage of hindsight to avoid timely missteps and mistakes. This is a way to build capacity and make the community stronger. Here are additional systems navigation strategies that you may employ. Know the players and understand the agency's eligibility criteria. Know the eligibility criteria for the agency you are recommending. The services they offer are secondary to whether a person is eligible. Have the parent develop an end goal. Have the parent or the person with a disability develop a plan and goals for what they hope to accomplish, their outcomes. This will help determine where to refer them for support. Advocate without emotions. Gather information and facts to help resolve disagreements and disputes. Learn the process of the respective agency. Understand their policies. Listen to what they have to say. Ask questions, take notes, be clear, and use facts to get the services the person with a disability needs. And lastly, engage the broader community. Ensure families and persons with disabilities have the knowledge and skills to navigate the systems, advocate, and access both paid and natural supports within the community. Educating parents and caregivers about possibilities for the future, such as self-determination, transportation options, and post-secondary school. Some useful skills as an independent facilitator. It helps to be able to schmooze, to chat in a friendly and persuasive manner so as to gain favor, business, or connections. Schmoozing takes good social skills and having the ability to converse to anyone at all walks of life to help you gain insight, knowledge, and or a favor for your client. Also, an independent facilitator should use a reasonable person rule. This is a phrase frequently used in law to denote a hypothetical person in society who exercises average care, skill, and judgment in conduct and who serves as a comparative standard. What would a reasonable person think or do? Another useful skill for any IF is to memorialize phone conversations with others in writing. Following a phone conversation, you send an email to thank them for their time on the phone and to restate what was discussed during the conversation. Now, contents of the phone call is in writing. If your understanding of the conversation is incorrect, the responsibility falls on the receiver to tell you. Otherwise, you can act in good faith that what was discussed is correct and agreed upon. You also want to confirm receipt of emails and correspondence. An easy way to do this is simply to ask the person for their written reply in email, or you can send postal mail certified with a signature required, or send fax, retaining a copy of the confirmation page. You can also walk things in via hand delivery and request that the agency date stamp them. These small things help with record keeping and ensuring everyone is on the same page. If you're helping a school-age child, make sure you familiarize yourself with special education assessments and understanding them. Similarly, you should understand the contents of the individual program plan, person-centered plan, and any other evaluations your client may have and that they requested your assistance with. You should also become an expert in asking appropriate questions and asking the next question, helping the client get what they need and presumably why they hired you, and understand how to respond when services are denied. You should be able to help an individual prepare for a fair hearing if the disagreement cannot be resolved at an informal level. This brings us to our activity for part 4. Please take a few minutes to respond to the next slide labeled Activity in the upper right-hand corner, and email us your response at orangecounty@scdd.ca.gov. Upon receipt of your response, we will send you the link for the Independent Facilitator and Self-Determination Part 5 on person-centered planning. Please research at least 3 of the laws noted on this slide: HIPAA, ADA, open meeting laws, long-term services and supports, Olmstead, HCBS final rule, etc. Explain why that is an important area to know for your clients. As an example, open meeting laws are important because they allow for members of the public to make public comments during various board meetings if they are having trouble with a system and want consideration for a solution. As a reminder, please respond to the slide labeled activity, the slide just prior to this one, and email us your response at orangecounty@scdd.ca.gov. Thank you for participating in Part 4, covering basic skills and knowledge. Take care, folks.